Would you be surprised if I showed you this picture and I told you this child looked well and this rash got better on its own? This rash is actually a condition called Idiopathic Thrombocytopenic Purpura, and it is a self-limited, meaning it will get better on its own in up to 85% of cases of children. While it looks awful, it is actually rarely causes complications, so let's talk about it. When children get viruses, their immune system is really active and it's going after all different kinds of cells, and there's all these different immune cells that are really active. And like a lot of autoimmune conditions, sometimes it gets confused and it attacks different body cells. In this case, it attacks the platelets and then also the spleen's ability to make new platelets. So the child's platelets or clotting cells go way down really quickly. Because there's nothing else wrong and the platelets they have are super strong and healthy, they mostly get a rash that looks like this. They can also have a little lacy red rash that doesn't change called petechiae. This is called purpura. They sometimes will get a little bit of bleeding around their gums and rarely bleeding anywhere else. So if you see a rash like this in your child, obviously you are going to call your child's doctor or go to the emergency room, as you absolutely should, because it takes a medical professional to rule out other conditions before they come to the diagnosis of ITP. ITP is diagnosed clinically, meaning that they rule out other things. So if your platelet count is low, you are well appearing, there is no other abnormalities, there is an obvious viral illness prior to it, then that pediatrician, doctor, emergency room doctor can make the diagnosis of ITP. Now, what do we do? Well, in most cases, up to 85% of cases, children will resolve this on their own. Once the immune system calms down, the body will start making platelets again, and we watch them over time to make sure that the platelets come back up. Very rarely do the platelets get so low that they need to be rescued and given factors to help them clot their blood. I've seen that once in 20 years. So it definitely does happen. Common age for this is young school age. So between the ages of 4 and 9 is the most common. If they get it over the age of 9, they tend to have something called chronic ITP, meaning they can get it more than once. So this is a really rare condition, thank goodness, but I've had to diagnose it recently, and I wanted to make sure that if you have heard of this, know of someone that's had it, just to give you a little bit more information, because obviously it looks really scary. If you have any questions, let me know.